Um, well, thanks for coming to Headache School tonight. My name is Liam Clark, and I'm the Headache Fellow here at the University of Utah as of June 2023 when we're recording. So for tonight's topic, I'm going to be going through what family history might mean for headaches. The title is what do you mean headache runs in my family? So anytime we talk about headaches in clinic, we kind of have to explain that most headaches are due to a mix of reasons. So there's some role that genetic or family history plays. There's some causes having to do with health or intrinsic causes that have to do with just the way that your body is for other reasons. And then there are extrinsic causes, which we call exposures. So think pollution or work history or sort of things in your environment, okay? So pulling back and talking about genetics, migraine is really common, which makes the statistics for this a little bit difficult. So it's been estimated that 1 in 5 women and 1 in 15 men have migraine. And about 50 to 70% of people seeking care for migraine have a family history of migraine, but not everybody with a family history of migraine gets migraine themselves. So kind of good news, bad news. The effect of the genetics seems stronger when both parents have headache. Possibly there's a greater male children than female children to be affected by this, but because it's so much more common in women compared to men, it might just be easier to measure the effect in men. For more migraine days, earlier age at onset, longer attacks, more severe migraine, and more frequent medication use, those are all associated with that family history. So it seems like family history seems to intensify migraine symptoms. Just seems to make it a more intense experience of the condition. So the other thing that migraine is polygenic, meaning many genes are involved. So it's not just one gene and we can test for it and say, yep, you have it, yep, you don't. But there are lots of genes that show up and have a similar appearance, the same migraine appearance, phenotype. So there are a few kinds of migraine special cases that specific genes can be tested for, but in general, it's sort of a big complex picture that contributes. A lot of studies focus on first degree relatives, so that's parents, but there may be an effect that goes beyond that. So like whether it's your grandparents or your parents' siblings that may have an effect too. So there's this idea of migraine threshold. A positive family history could lower the migraine threshold. So you're just a little bit more likely to cross over into having migraine with that family history. So if you know that your parents have migraine or you have migraine yourself and you have kids, watch out in your kids for severe vomiting or recurrent vomiting, being sensitive to light and sound, like, they want to go lay down in a quiet place. They don't want to play. They get irritable if they're around noises. And a headache that's worse with activity. So if you're like, okay, well, let's just car, let's leave. And they're like, I don't want to. It feels so much worse when I try to do anything. Those are kind of maybe some early signs. And because of that lowered migraine threshold, even if they don't have headache yet, you want to be careful about exposures that could predispose them to headaches. So potential triggers like concussions and head injuries play a role. So wear your helmets, wear your seatbelts. So this migraine threshold concept, I'm going to talk a little bit more about this. So one way of explaining this is using the bathtub metaphor. So if you go to that white line down on the bottom, that cream color, that's maybe your average person without a family history. That's their migraine threshold. So their water level's down here, and they have to fill up to this line in order for it to spill over and for them to manifest with a migraine headache. So maybe that's dehydration and it's hot out and they haven't slept and they had a bunch of MSG and caffeine, and then finally they get a headache. Whereas this orange line is this person a heightened migraine threshold, maybe from their family history. So they don't have as far to go before they trigger and end up with a headache. So this is why we focus on exposures when we're talking about preventing things in people with a family history of headache. So risk factors or exposures, we're talking concussion, head trauma, hits to the head. Pollution maybe plays a role. Seems likely that it has some kind of role, but exactly how much, exactly what kind of exposures, we're not quite sure yet. Stress can be a risk factor, but again, it's kind of amorphous. What kind of stress for how long? Poor sleep may also contribute, and depression. So managing the lifestyle of stress management, getting good sleep, addressing mood problems, and avoiding as much as possible any head injuries are all good things to do if you have a family history or you know that you or your family members do. So here's that special case I was talking about where we do know the genetics a little bit more specifically. It's called familial hemiplegic migraine. It's migraine that has motor symptoms, which is to say movement, so that people experience weakness or paralysis on one side of the body. So I pulled out this little infographic about it. So you get the motor weakness, and then you get some of the other symptoms that can come along, like tingling or spots in the vision, or maybe a little bit of slurred speech. And then you get the migraine sensitivity, the headache, light sensitivity, nausea, vomiting, kind of the whole complex of things. And there are a couple different types that have different genes associated with them. So if you're looking kind of across, there's type 1, type 2, and type 3. And the first bullet point down are the 3 genes associated with each. So that if you get genetic testing, you can actually pin it out and say, it is there, it isn't. You can see one codes for calcium channel, one codes for an ATPase, one for sodium channel, and they're on different chromosomes. So kind of what that means is that they are genes that are coding for structures that have to do with nerve function. Sort of electrophysiology is the sodium and calcium, and to a degree, the ATPase. You need all of those channels to work to have your nerves function optimally, normally. So what does this mean for the average person watching this video? Talking to a neurologist or a genetic counselor may be worthwhile if other people in your family have migraine and you have symptoms like weakness during your migraine, and or you're planning a family. So this is kind of more specifically when to look into the genetic counselor kind of angle, getting genetic testing for thinking about your headaches and your family. What about other kinds of headaches? Just as an aside, we've talked a lot about migraine, and migraine is really common, but there are definitely other kinds of headaches. So for cluster headaches, we also see that there are multiple, or what are called susceptibility genes, so genes that predispose somebody to developing it. And then there are environmental factors that seem to play into actually fully developing the disease. 10 to 20% inheritance is estimated. So, if you have 10 children, maybe one of them gets that susceptibility. And then it seems to follow an autosomal dominant pattern. So it seems to follow more strongly than you would expect in that inheritance pattern. So you're more likely to see if one parent has it and it shows up in the next generation. But there have been some that show a recessive pattern, which means it can kind of skip generations. It may be more common for women with cluster to have a relative with cluster. Again, it's maybe that same bias with men who get diagnosed with migraine being easier to see the genetic trend. Cluster is considered to be more rare in women, so maybe it's easier to see that trend. Chronic cluster, a more severe case, more severe presentation, tends to have a family history, so kind of the severity, just like with migraine we see. And then triggers for cluster headaches, you're really looking at smoking, smoke exposure, alcohol, and head injury. So the same idea, lifestyle stuff that you're probably already hearing about for other reasons. Idiopathic intracranial hypertension, for an example of other causes of headaches, unlikely to be directly related to inheritance, but there are other risk factors that can maybe play a role in developing it, like body weight or autoimmune disease, that may kind of have a loose association. For tension headaches, they're really common and are underdiagnosed, and they're not having people seek treatment a lot for them. But they seem to be a little bit more common in families with other types of chronic headaches. So there's some headache predisposition that travels there too. So thinking about, well, practically speaking, what can I do for myself? How do I be proactive about this? Know your family history. And a lot of times that just means asking. So ask your parents, if they don't know or they don't want to talk to you, ask their siblings or ask their parents. Ask your siblings and see, are there people with headache and we just never talk about it? Because that can be really relevant and really helpful for everybody. Avoiding triggers. So helmets, probably the number one, but smoking, drinking, stress, sleep deprivation, pollution as much as you can, modify those is good and important. And then the last thing here is kind of where we come in, is seeking medical help. So if you have headaches, it's not like you just have to sort of suffer through it and deal with it. Like there are headache specialists, there are people that deal with these disorders, and there is medication that's helpful. So seeking earlier instead of waiting for things to reach to a crisis can be really helpful for you, but it can also be helpful for your kids or your other family members who maybe encouraged by your example or be given kind of a lead on what they should do to help treat their headaches. So kind of a funny quote to wrap up: people don't need to have a head in order to give someone else a headache. Um, just to kind of wrap up with something a little funny. The bottom line is, though, that you don't have to kind of try to suffer it out and not seek help and not reach out to other people in your family, because odds are if you've experienced it, someone else in your family's experienced it too. And that's it. Thank you for coming.